Daktari Akwikwa. Karibuni to yet another episode of Daktari Akwikwa. Leo, kama nilivyowaahidi, tuko na a very interesting guy here. Very funny in my opinion. Anachekeshanga huko mtandaoni sana. So it's actually rare to find a doctor who's so easygoing like that. So like Apple, you last not to be in a story. So that's why today we are Dr. Reuben. Karibu to Daktari Akwikwa.
Thank you.
You're welcome. Still at home with this plant over there.
That I really nice place.
Thank you. Nakoge yamani, unajua yamani.
Hiyo sasa. Ninajaribu hiyo sasa niko na pesa.
So, welcome to Daktari Akwikwa. We are very, very pleased to have you here.
I'm also happy to be here. Thank you for the invite.
You're welcome. And so, I usually give my dad the pleasure of, kujisema vile wanataka kujulikana. So, please, by all means, introduce yourself. Tukujue aje. Dr. Reuben.
Okay. My name is Dr. Reuben KAmundi. Dr. Reuben KAmundi. I'm a plastic, reconstructive, and aesthetic surgeon. Yeah, so that's my name and what I do. How else would like to do?
Karibu, we shall find out more as we go. Yeah. As we go. So you are you said a
plastic, reconstructive, and aesthetic surgeon.
All those are different.
Yeah, they're different. Well, they're correlated, but they're different in a way. So plastic surgery is the broad terminology. Then what we do two things. We are reconstructive surgeons. Reconstructive surgery means that we try and restore what was the normal anatomy, what was initially there but was lost. And then in the process of restoring, you also need to refine what you restored so that it looks good. Okay? So that it looks near normal.
Yeah.
And that's where aesthetics
counts. Or better than normal.
Yes, better than normal, so to say. So we do reconstruction. For example, if you sustain burns.
Yeah, that's not reconstruction.
And that's reconstruction. If a lady has very big breasts and you like them reduced,
that is it.
That is reconstruction. If a lady loses part of her breast or the whole breast due to breast cancer, and they would like reconstruction done,
that is another reconstruction.
Then now there is the aesthetics bit. Aesthetic is the medical terminology. What you know out there is cosmetic surgery.
Kurembo.
Okay? So sasa aesthetics, aesthetic surgery is where now beauty comes in. The whatever you can think of, the liposuctions.
My nose is too big.
The rhinoplasties, the blepharoplasties. Rhinoplasty is basically nose job.
Oh, okay.
Rhinoplasty. Rhino is nose.
Oh, yeah.
Then the pharoplasty is your eyelid. The eye bags. Who have problem with the eye bags. That's the pharoplasty.
What kind of problem? Like it, you have a lid lag?
No. Now lid lag is reconstructive.
Okay, because it's a pathology.
That's a disease. That's a pathology. Now, blepharoplasty or eye bag surgery is basically, you've seen as we age, we tend to add fat herniation down here.
Okay.
Tend to see a bit of a fat collection, fat pocket. Okay. And then for the upper eyelid, you could have the same thing happening. And also excess eyelid skin.
You have the wrinkles.
The wrinkles, exactly. Now that's blepharoplasty. Then you have your facelifts. Okay. We pull back the skins to try and tighten and treat the wrinkles. You have your chemical peels, Chemical peels, these are things we apply on the face that remove the fine wrinkles. Your skin peels off. So chemical peel, basically you're using chemical to peel skin.
Okay, so we are removing the chemical.
Yes, in the process we end up removing the fine wrinkles on the face. Okay.
That's surgery. That's
aesthetic surgery. Okay.
Now,
aesthetic surgery also is divided into two. You have the surgical and non-surgical. Okay, so the non-surgical is your chemical peels. Then the surgical is now
Because I have a friend, I don't know if you know her, her name is, she call herself a wandering doctor. Doctor,
I know her.
yeah, Dr. Diana.
Diana.
Dr. Diana, we were talking the other time, she was telling me she's done aesthetic medicine.
Yeah, no.
How different is that from plastic?
Aesthetic medicine is used to plastic surgery. However, it lies more on the non-surgical.
Okay.
So your chemical peels,
Botox.
Botox, yeah. So the umbrella is everyone. All that is under plastic. Yeah.
Okay.
Because it's the plastic surgeons will teach aesthetic medicine.
Is that in Kenya? Are we offering that in Kenya?
Yeah, we're offering a master's degree. So
In aesthetic medicine.
masters in plastic, constructive, and aesthetic medicine.
That's
Yeah, but we not have aesthetic on the body. It's not at the moment. No, that includes also your hair transplant.
oh. Wait, are we doing that yet in Kenya?
Every day we have so many patients who are doing hair transplants.
Nasikia watu wanaenda Turkey to get hair transplant.
Yeah, people are still going to Turkey. People are still going abroad for some of these cosmetic procedures, and that really we are doing them.
So hair transplant. Yes, Tivo. Help us, please. I have a cousin of mine. Like Parenamsubwa.
So that's just in a nutshell. Yeah.
So hair transplant, and we're doing it successfully because they're doing it successfully. There are cases of breast transplants.
Well, I always advise people and tell them before you commit to a doctor or to an esthetician, do a background check. Just try and find out what are their qualifications. Did they really study for this? Because we have people who learn on the job. We've had technicians we've trained to work for you, under you, okay? And then they end up anatoka anaenda anafungua mali yake. Juta aesthetic specialist man.
And I think that's actually a problem that's not just in
the US.
Yeah. Because even on X the other day, people are having a discussion about, clinical officers and, CS and CSs and doing some of these procedures. And, it's people, it's like a free market.
I don't know, a free market, but that's where the vote comes in, the medical board, to try and regulate some of these
practices. Yeah. But does it do a good job, in your opinion? Does it do a good job? Because there's this case that hit the internet a few months back, was it last year? Yeah, about there's a very famous clinic, plastic surgery. Surgery went bad, and then the patient ended up losing their lives. After we gone for a cosmetic surgery, so to speak, that is elective. Then you end up losing a life from that, and it was spark a lot of debate. The board was involved. They were saying the clinic was not well regulated.
Well, we have challenges, a lot of challenges in this country. But what I'll say is that, again, we go back to my previous statement. Before you commit to a doctor, not just a bad resource, just do a background check. Just the simplest thing you can do is Google their name.
Yeah.
If you Google their name, then the medical board has a list of all the doctors. They'll be able to tell you if this doctor is licensed or not.
And the registrar is actually authentic.
Yeah, and what type of registration are they? Do they have? Somebody could be a general surgeon, and since they're general surgeons, they will purport to be doing plastic surgery. So the lady who passed away last, it was quite unfortunate. Even as plastic surgeons, we were quite amazed or in shock.
Perplexed.
Yeah, perplexed, man. Because my lecturer always said that cosmetic
surgery
patients, who come to you are not patients. They are
clients.
They are clients, and we refer to them as clients because that's what they are. Mtu akikuja kwako for tummy tuck, if someone comes for tummy tuck or for lipo, they're really not sick.
They're not sick because they can't call them a patient.
Yeah, you can't call them a patient. So my teacher will always say, please do not convert them into a patient.
Yeah.
Just treat them as a client. Do that lipo, do that tummy tuck, do that facelift, do that nose job, okay? And let them walk out
Okay, wako sawa.
better than they get.
Better than the, or at least the way they came in.
So at least the way they came in.
We're unable to do it.
Exactly. But now going to the extent of converting them to patients, that's unfortunate. Well, we do have complications. No,
So we did any surgery.
yeah, no surgery is 100% safe, but we always try our best to avoid some of these complications. Okay, and they say that the difference between a surgeon and a quack, a doctor and a quack, okay, is the ability to
know when not to operate.
Yeah, there's that ability to know when not to operate, and also the ability to deal with complications. Okay, so if whoever you're going to is not able to talk about complications, the potential complications, and how to avoid them initially, and if in case you get the complications, how to deal with the complications, then you need to put a question mark before you commit to a doc.
But then there's something you're mentioning about the clients, so to speak. I mean, I'm looking at the doctor. But, it shouldn't be like that in the first place. The responsibility shouldn't be the clients, the doctor. Or, well, for cosmetics, that's their responsibility. But, if I have, as a name, probably if I have a patient who needs reconstruction and I refer them to you, I should refer them, to a person who is standardized. Like, you on a board. If they're practicing, the board has made sure that, they're doing what they are licensed to do. Yeah. So I think there's still the gap where the board needs to come through.
Yeah, I think the board has embarked on doing that, actually. We saw a number of clinics being closed down in the recent past, especially, they've closed down quite a number of clinics that were operating illegally, quote unquote. And then they're also trying to create a database for all the plastics,
This was plastic.
all the dermatologists, basically, and even in the other specialties, they're trying to ensure that if you specialize in a particular field, they try and stick to that particular field.
Oh, see, it's in the...
Yeah, because as a most, you can do any surgery.
How it's on?
Yeah, medical officer can do any surgery.
MDSHB.
Yeah, but now the problem with that, you get a complication, you'll be asked, was there no specialist?
Exactly. And we were having a discussion with the clinical officer on the podcast, and they were insisting that as a clinical officer, they are licensed to do certain surgeries. Because I asked them, and even some people online, I asked them, as a clinical officer, if things go south, who are you working under? Because me, as a medical officer, if I'm doing a CS, there is a dying center. If I'm doing an amputation, there may be an auto, relevant specialist.